And thanks for joining us tonight. Yeah, 1 year ago tonight, there was an excitement, a hope building in our community. Scientists operating with warp speed had basically performed a medical miracle. In a matter of months, they had created a vaccine to blunt the COVID-19 pandemic that had swept across the globe. Those shots were becoming available to all of us.
There's 42 pods, and you can sit 4 patients at each pod, so we'll be able to have a throughput of about 168 patients at one time.
I don't want to take it home to my husband who has high risk, and I just want to make sure that I'm very safe, and it gives me a lot of security knowing that I'm going to be around all kinds of people and children.
We want to live a long time.
There was a real sense better days were coming, and sometimes lost in the debate over mandates and messaging is a truth that these vaccines, while not perfect in preventing infections, have saved lives. And here's the clearest example we can give you. These graphs here are from Johns Hopkins University. This is North Carolina data, by the way. The top graph, this yellow line that you see here, is daily cases throughout the pandemic. The bottom graph here is deaths. In January of last year, we peaked at about 100 deaths a day. This while we were seeing about 6,000 cases a day. So now go to January of this year. Cases had quadrupled from the previous winter, more than 24,000 a day. But note here, deaths didn't follow. They didn't go up 4 times. In fact, despite the avalanche of cases, the number was lower than it was the year before. It was also lower than the Delta wave in the summer. We topped out at around 70 deaths a day. The improvement is worth recognizing, which is what happened in Charlotte today. Novant's frontline healthcare workers took some time to mark 1 year since the vaccines became widely available.
Today isn't the anniversary of the first vaccine that we administered here in the greater Charlotte market. It was a hopeful time. We had been well into our 9 to 10 months of a pandemic, and we're very hopeful about what relief vaccines could bring to the work that we were doing. There were a lot of unknowns early on, just staying tuned to the state as information came on how to handle them, how to store them. Logistically, we did a couple of things early on. We knew that we needed a bigger area than we had for testing. Testing was more mobile. We could do it outside smaller sites. And we needed a place that was safe from the elements and things. So a different strategy than we took with testing. And so we went for a large location. We actually started out on East Independence, which we were really excited about because that was one of our underserved zip codes that we could be in the middle of. I mean, we saw some days over 1,000 patients in a day getting vaccinated.
I started volunteering with Novant the first week that they opened the clinic on Independence Boulevard. I was the first shift of the first day. Well, I think a year ago, it was still pretty dark days for North Carolina and Mecklenburg County. The rates of infection and death were still pretty high, and like you said, people really hadn't started to get the vaccine yet. So I think for a lot of us who were working from home and were in a different environment, things were pretty dark. My sister and my cousin who are in the medical field just really struggled through the first year of the pandemic, and I just really wanted to do something to help my communities.
The volunteers have been amazing from day one, so they have shown up and been very consistent. I mean, they're just a part of the team. We know them well, and we just appreciate them so much. I would say that we probably would not have been able to deliver on more than 500,000 vaccines if we didn't have volunteers supporting us.
I've helped people with registration, I've helped people in the waiting area, I've cleaned chairs, and now I'm mostly working in the pediatric shot room. The medical community is so tired, and they've just worked so hard that it's really everyone else's responsibility to pick up the slack for them so they can have a break. And I feel like I'm just going to be here until they kick me out. I'm right a little bit over 400 hours at the clinic now, so I'll just be here until we close down.
When I look back on this time, I think I'll remember, you know, the hopefulness that came with the vaccine and what it looked like for the community and the healthcare systems to have one goal together that we were going towards, and you know, just really how beautiful that work was, to be aligned, to drop the competition, if you will, between health systems and just really align with our communities and having one goal of wellness and you know, life-saving vaccinations for our communities.
By the way, WBTV on your side with the latest on vaccine availability, what has been approved, who is eligible. Just go to WBTV.com/vaccine.